And welcome everyone. My name's Gina Buckles. I'm one of the advisors at 401k Plan Professionals. And on behalf of our team, I just want to say thank you for joining us for this annual Medicare webinar. We do it every year. It is important, it's comprehensive, it's complex, and Medicare has a lot of nuances. So thank you for joining us. This is part of our webinar series. This year we have 14 webinars scheduled. Last month we did Social Security. Now, of course, today we're doing Medicare. Keep in mind, these are recorded. So you will get a recorded, an email with a recorded link. All of these webinars are housed on our website and our YouTube channel as well. One thing I always like to tell people is we're not going to be able to make you an expert in Social Security or Medicare in 1 hour, but hopefully you know that you can go back and rewatch it. We also have a great Q&A guide for Medicare. Thank you to Ron and John Hancock. So we've got a number of resources available to you later. So again, keep in mind, it is recorded. You can rewatch it. You can share it with others. Our website and YouTube channel, it's 401k Plan Professionals. So very simple, very easy to remember. And hopefully you utilize those resources when you need it. Of course, if all else fails, you can always reach out to me. I can always send you the recording and any of the Q&A guides. So without further ado, I would like to introduce our speaker, backed by popular demand, is Ron Bezis with John Hancock. He works in the retirement plan investment space. He has been in this business for over 20 years. He has a ton of wealth management and investment management expertise. He is also very knowledgeable on the topic of Medicare. He does these presentations across the country to a number of different demographics. He is, like, as I mentioned, very knowledgeable. He's going to do a great job answering all of your questions. Speaking of questions, thank you to those of you who submitted questions in advance. Ron has already reviewed those. We're going to make sure we answer all of those questions throughout the presentation today. And of course, put any other questions in that Q&A. So we'll keep our eye on that. We'll make sure we get those questions answered as well. So Ron, I'll let you go ahead and kick it off.
Great. Thanks so much, Gina, for the warm introduction. Thanks so much to the entire 401k Plan Professionals team for having me back. And thank all of you for joining as we talk about this important topic known as Medicare. Like Gina said, I'm Ron Bezis with Manulife John Hancock Investments. And let's begin. Because as everyone knows, retirees are faced with many topics that they need to know about. But some topics are more important than others, such as really understanding Medicare and the impact it can have on your long-term financial plans. I think that by better understanding Medicare, you can not only better prepare for future healthcare costs, but you can also help to avoid making mistakes as you're going to go through that process. So that really brings us to our goals for today's discussion, which are twofold. The first one, of course, is for everyone today to walk away with an enhanced understanding of the Medicare system and how it works and how it operates. And then the second goal is the bigger challenge for me, is to try to do so in a way that's not going to put everyone back to sleep and make you all bored, because we know the Medicare content is dry and it's confusing. So my goal is to really talk about this information in a way that's going to keep everyone engaged and entertained as we go through it. So with that, let's dive right into the presentation. And as you see this couple here on the screen before you, a few things might jump out. It could be looks of, other confusion, being lost, trying to connect the dots, etc. The reason for that is because this couple is turning 65 years old, which means they're now eligible to receive Medicare, and they're trying to figure out what in the world is going on with it. They've been getting inundated in the mail. There's a whole big stack of paperwork. They're trying to read through it all, connect the dots. As they're trying to do that, telemarketers keep calling, trying to sell them some form of a Medicare Advantage plan. And then when they want to take a break, they turn on the TV and it's like 10,000 Medicare Advantage commercials where people like George Foreman and Joe Namath talking about how great their Medicare Advantage plans are. And there's a lot on this. It's confusing. And we ask, is this how Medicare makes you feel? Because it's what we find how it makes most Americans feel. They, again, did not make it easy on us. But the very good news is that we all came together today to break it all down And I think the best way for us to do that is by following this agenda that you see here on the screen before you. Now, before we move forward, I do quickly like to take a step back and talk about the history of Medicare. I think it's important to understand how large scale this really is. After we do that, we're going to cover the different parts of Medicare and what enrollment looks like. As we go through this discussion, I'm going to bring up different costs of what it might cost you on a monthly and annual basis. You can kind of begin to maybe plan what future costs might look like. Towards the end, we're definitely going to allocate some time in doing a comparison of the Medigap plans versus the Medicare Advantage plans. Definitely going to talk about that. And then we're going to wrap up by talking about working past age 65. So that's the agenda for today. And let's begin with the history of Medicare. And as you can see it on the screen, right, the big day, July 30th, 1965, President Johnson signed Medicare as we know it today into law. Now, why was that such a big deal? It was such a big deal because at that time in the United States, there was really no form of next step healthcare when folks went off of group benefits and retired. There was no standardized form of healthcare. And we only saw about maybe half of Americans, retirees, having actual healthcare. And to make matters worse, we had about 8 million seniors living in poverty because they couldn't afford their medical bills. I mean, how devastating is that? People working their whole lives go into retirement and like no one has health care, people living in poverty. I mean, this was a big problem in the US at the time. So several presidents tried to get something passed unsuccessfully. Started with Roosevelt, JFK. You can see here in the middle, Truman really tried to get something passed. So when President Johnson was finally able to do so, wanted to honor those efforts, gave him and his wife cards 1 and 2, and we saw 19 million Americans enroll. That was then. Today, there's about 65 million Americans enrolled in Medicare. And many economists are saying that by 2032, there's going to be about 72 million Americans enrolled in Medicare, and it's going to be about 15 to 20% of the US budget. Think of how gigantic that number is. I just said the trillions of deficit we have. This is one of the big threes. It's national defense, Social Security, Medicare. Really important to understand the magnitude of how large this really is. So with that, let's move on. If it's not obvious, I'm from the Boston area with the accent. I am convinced they put the slide in just to hammer it home. So I will read it as they put it in with Medicare. Starts with the parts. There it is. We said it. But with that, most of you know there's really 4 parts of Medicare. It's A, B, C, and D. We're going to talk about each one. We're going to start with Part A. So your Part A coverage is going to be inpatient hospital stay, okay? Any sort of coverage you get within the walls of the hospital is going to fall under your Part A coverage. So you can see here, like I said, inpatient hospital stay, any sort of skilled nursing you might receive up to 100 days, any sort of medication, blood transfusion, all of that falls under Part A, as does any hospice care, okay? So that is room and board in a hospital. Now, moving on to Part B, that's really going to cover everything else. That's going to be your outpatient coverage. So things like seeing your doctor, maybe some lab work you have done, maybe you have an outpatient surgery, anything preventative, right? Maybe you have some equipment in your house, in your home. All those kind of things are going to fall under Part B. And what's great about Part B, if you look to the bottom here, is that anything the government deems as being preventative, they're going to pay for all of the cost. 100% of that cost they're going to pay for. However, it's important to note that anything they don't deem as being preventative, they're going to pay for 80%. But a lot of Americans don't know that we're on the hook for 20% of that cost. And as you see this gentleman here laughing, having a grand old time, it could be that he doesn't know he's on the hook for 20% of that reconstructive knee surgery he's in there for. But the good news for him and for all of us is there's ways we can plan for that cost. We're going to talk about that in a bit. But what I want to talk to you right now is what original Medicare is. That only refers to parts A and B, as those are the only 2 parts we get from the federal government. Okay, so when you hear original Medicare, that's only talking about A and B. Part C and Part D are not mandatory, and you will get those coverage through a private insurer. So when you hear Medicare Part C, that is talking about the Advantage plans. That's the option we have as Americans to get our coverage, all of our coverage, through a private insurer. So almost think about Part C like a travel agent, right? Where you would get the rental car, the flight, and the hotel, right? Under one nice, neat umbrella. That's the way Part C works. And then moving on to Part D, Medicare Part D is going to be all of your prescription medication needs. So that's going to be your drug plan, to cover any sort of medication that someone needs is going to be under your Part D. So those are the 4 parts of Medicare. Next, I'd like to talk about enrollment because I get asked this question a lot. And I'm actually going to begin here at the bottom with number 2, as it's the easiest to understand. We know you're eligible to receive Medicare at age 65, but we also know you can begin taking your Social Security benefits prior to that age, at age 62. So if someone decides to tap into their Social Security benefits prior to age 65, their enrollment in Medicare is automatic. The government's going to automatically assume, because you're on Social Security, you also need Medicare, and a month or 2 before your 65th birthday month, you're going to receive your Medicare card in the mail. Nice and easy. But moving up to number 1 is still easy as well if you're not yet taking your Social Security benefits. The way you would do that is you would go to the Social Security website. So that's going to be ssa.gov, okay? Only takes about 10 to 15 minutes to do it. It's pretty easy. And the first time you can actually enroll in Medicare is going to be dependent on your birthday month. That's going to determine what's called your IEP, if you've heard of that. And that stands for your initial enrollment period. So what that is to enroll for the first time is you have your birthday month, okay? And then you have 3 months prior to that to enroll, 3 months following that to enroll. So let me give you an example of that. We're going to take an example of someone whose birthday is May 20th, if you can see my mouse down here, okay? The first day that person could enroll in Medicare is going to be right here, February 1st. Sometimes we hear people saying, Ron, I want to enroll in Medicare. I want to make sure it's all set. I just want to get it over with. We love the enthusiasm. Just know you cannot do it on that website until the first day, 3 months prior to your birthday month, okay? And then if you enroll prior to your birthday month, say the same person enrolls here on March 10th, then the benefits would kick in the first day of your birthday month. You don't have to wait until your birthday. This person doesn't have to wait until May 20th to receive their benefits. Their benefits would actually kick in this case, on May 1st. And then lastly, if you enroll in or after your birthday month, the benefits kick in the first day of the following month. So what I mean by that is, say this person decided to enroll, say here on July 5th, benefits would begin on August 1st, okay? Now, if you decide you don't want to enroll initially or you want to delay, things like that, just know that you would be able to enroll in original Medicare the first quarter of every year. So January 1 to March 31st, you can enroll in original Medicare every single year. And then before we move on, because I do get asked this a lot, if folks decide to stay on group benefits, not enroll at age 65 and delay that, say they want to retire and they go off of group benefits, once you receive from your HR something in the mail saying your group benefits end, you're going to have your own unique 8-month window. You're going to have 8 months after your group benefits ends to enroll in original Medicare. Plenty of time to do it. Okay. So next we're going to talk about what cost sharing looks like. And I think what's easy to understand with Medicare, which is nice for once, right, is that it does work similar to group insurance in the way that we pay our monthly premiums. Okay, we do the same thing for Medicare. And then we have cost sharing just like we do currently, where we have co-pays and co-insurance depending on what procedures we have done. Medicare works the same that way. And I'd like to take it a step further on this slide and talk about Part A. What is great about Part A is if we've worked for 10 years and paid our FICA taxes, that means we've accumulated at least 40 quarters of work history, and that means Medicare Part A will cost us nothing at all. Okay, that is $0. Government's going to cover that as long as we have that work history, because we know when we pay FICA taxes, some of that goes into Social Security, the other portion goes into Medicare. So if we have that work history, Medicare Part A will cost us nothing. And that's important to know because sometimes folks don't have 40 quarters. They have maybe 30 to 39. In that situation, Medicare Part A would be about $250, $300 a month. And anyone who has below 30 quarters, it's like $500 a month. I mean, this can get really expensive. Just for Part A, Medicare can be expensive on its own. So we want to make sure you get Part A paid up. Now, before we move on, there is a few ways you could qualify through a spouse that I want to talk about. The first one in the middle here is if you've been married at least 1 year, and of course you'd need to be 65, but your spouse would need to be of the eligible Social Security age. They don't have to be taking Social Security. They just need to be at least 62. You could qualify through a spouse. Moving down, believe it or not, you can be divorced and actually qualify through an ex-spouse as long as you check a few boxes of you'd need to be married at least 10 years. Your ex-spouse would again need to be of that eligible Social Security age, and you'd still need to be single, meaning not yet remarried. You could qualify for Part A through an ex-spouse. And then moving down to the bottom here, in a widow situation, you would still need to be not yet remarried and married at least 9 months prior to date of death. You would qualify through a deceased spouse as well. Now we're going to talk about Part B and D premiums, and we're going to table Part C for the moment. Again, those are the Advantage plans. I promise you that's a whole section we're going to tackle in a bit. But for right now, we're going to talk about Part B. In this year, the monthly premium did go up a little bit, so that's going to be $185 a month. Anyone who's taking Social Security, just know that that is automatically taken right off the top of your monthly bill, or I should say check. You don't have to do anything at all. If you're not yet taking Social Security, you're actually billed on a quarterly basis as opposed to a monthly basis. And the way you would pay that bill is going, again, on that Social Security website to set up like an auto easy pay type thing. Next, I want to talk about a really important subject. I get asked this all the time. It has to do with something called IRMAA. This impacts high income earners. It came out in 2008. I can promise you no one was happy when this came out. A lot of times when I do this live, in person, we get moans and groans. If any of you have heard of this, you probably made that noise. I just can't hear you through the speakers. And basically what it's saying is the more money you make, the more money you pay for your Part B and Part D premiums. So on this slide, let's talk about this a little further because this is really important to know. Now, I just told you that the monthly premium is $185. That is true if you look in the top here. That is also true for folks who file individually making less than $106,000 a year, or folks who file joint making less than $212,000 a year. They're paying the $185. Anyone making north of that is going to be paying more. So let me give you an example of a household who files joint and they make $300,000 a year. Okay. If we go to our tax brackets, they are going to be right here. Okay. And then they're going to be paying $370 a month. And that is each person. Okay, just because they file joint doesn't mean they pay Medicare joint. Medicare works individually. That means each person in that household will be paying $370 a month. And if someone didn't know about IRMAA and they budgeted for the $185 a month, I mean, this could be impactful to someone's retirement budget, right? We want to be aware of how IRMAA works. So to continue this, the way IRMAA works is say you or someone enrolls in Medicare this year, 2025. What happens is the IRS is going to do a 2-year look back on your tax returns. In this example, they're going to look at someone's 2023 modified adjusted gross household income to take a look at what the income looks like, okay? And if it hits any of these tax brackets, you might get an IRMAA bill in your mail. I've heard people paying the $185 for a few months, and then all of a sudden there's a bill in the mail, and they say, what in the world is this? It has to do with IRMAA. Now, before we move on, I do want to make sure everyone knows there's ways you could file a qualified appeal to the IRS. Okay, that appeal form would be form SSA-44. You can get that right on the Social Security website. It's actually it's like half a page to fill out. And what you'd want to do is show the IRS you have a change in your income. You have a life event that has changed your income. Okay, maybe you got married and that impacted your tax bracket. Maybe you got divorced and your ex-spouse was more the breadwinner. Widow situation, okay? Maybe you retired, reduced work hours, things like that. The government would probably grant you the appeal on your IRMAA. Now, let's flip that and talk about a little bit of tax planning for everyone. Maybe some situations where the government would not grant you that appeal, okay? Maybe someone took a large 401k, IRA distribution, sold a boat, beachfront property, right? Things like that. The government would not grant you the appeal on your IRMAA. So if you know you want to do any of those things, just be cognizant of that 2-year look back, right? Maybe someone wants to take a big chunk of their 401k, use that as a down payment for a Florida house. In this example, just be cognizant of when you take that large distribution, the 2-year look back on when you file for Medicare, okay? Really important to know about IRMAA. Okay, moving on to Part D. Again, this is going to be your medication coverage. This is going to range over how much medication someone needs. And you can see here, these plans are all over the place with $0 a month to well over $100 a month. I think my father-in-law pays like $3 or $4 a month, but he's only on cholesterol and blood pressure medication, not much at all. So he doesn't pay much at all. But just to give you a sense of what Part D might look like, with the national average being just over $55 a month. Now, really important is I want to bring everyone's attention down here. Where in the beginning I said Part D isn't mandatory, and that is true, but it doesn't mean Medicare doesn't track your enrollment. In fact, if you enroll in a Part B plan and don't enroll in a Part D plan, but do so at a later time, there's actually a penalty for that. The penalty would be 1% each month in the gap of when you enrolled in both of those. Let me give you an example of that, because a lot of people can barely understand how Medicare works. Now we have these penalties, okay? And when someone gets hit with a penalty, the government is very unforgiving, unfortunately, and it sticks with you forever. It does not go away. So let's talk about this. The way the penalty would work on Part D is we have an individual who's 65, healthy as can be, enrolled in Medicare A and B, has no medication needs, and they say, why in the world would I enroll in a Part D plan? I don't take any medication. Think that makes sense, right? Pretty logical thought process there. Now we're going to fast forward 5 years. That same person is 70. They become sick. They have medication needs, and they say, hey, I need one of those Part D plans to cover my drugs, okay? The government's going to say, well, wait a minute. You enrolled in Part B 5 years ago, so 5 years times 12 months is 60. You now have a 60% penalty tacked on top of your Part D premium that never goes away. How unfortunate is that? So something we might want to do, hopefully everyone's healthy as can be, when you enroll in Medicare, find the absolute cheapest Part D plan you can get. The important thing is that you have the credible coverage in place. So every fall, keep in mind, you can always change your plan. If your medication needs increase, you can always get a new plan. The important thing is that you're in a plan, okay? All right, so this slide looks like the Part B one, but IRMA unfortunately comes into play when we talk about Part D premiums as well. Let's go into the folks making 106 or 212,000. They just pay the premium every month. But let's go back to that same couple making 300,000 a year. Well, they would be paying each one an additional $35 a month on their Part D because IRMA came into play again. What I can tell you is if you file that appeal for Part B and they approved it, the nice thing is they're going to automatically approve that for Part D as well. You don't have to file a second appeal. But the flip side is also true where if they deny you Part B, they're going to automatically deny the Part D as well. So the two work hand in hand that way. Okay, so those are premiums. Next, let's take a look at cost sharing. And I do like to pump the brakes here on this slide. And not meant to scare anyone. A lot of times when I do this in the room, everyone's kind of, doom and gloom with arms crossed. I get it. The important thing is that we understand what Medicare costs are going to look like. It's important that we do it now so then we can begin to wrap our heads around how much this might be, because what we find a lot of Americans thinking is that they say, hey, look, I paid my FICA taxes. I'm on Medicare now. I'm on the government's dime. They're going to pay for it all. Well, they're going to pay for some of it, but it's on us to pay for some of it as well. So let's talk a little bit about what it might cost us, okay? So Part A, inpatient hospital coverage, deductible is just about $1,700, okay? So, again, I'm from the Boston area. Let's say in January, I slip on some ice, I break my knee, I have an inpatient hospital stay. They hit me with that deductible right off the bat. I realize this is a broken knee, but let me just elaborate in this example. I'm in the hospital for 60 days. Government's paying for all of that. Now you notice on day 61, a daily copay begins at $419 a day I'm paying. 30 days after that, on day 91, that doubles to $838 a day. And then after day 150, we will be paying all of the costs in a hospital, okay? Also, the government's going to pay for the first 3 pints of blood in a hospital. If they don't have your blood type, we're paying for that. Anything additional, we're paying for that. What they are going to cover is 20 days in a skilled nursing facility. You might notice on day 21, a daily copay kicks in at just about $200 a day, all the way up to day 100. Because, Part A isn't meant to be long-term care insurance. That's another whole product you probably heard of. It's really just meant to cover basic inpatient hospital coverage, okay? So that's Part A. Now we're going to talk about Part B. You see here the deductible this year is $257. And moving down to the middle here, we talked about in the beginning, they're going to pay for everything being preventative. But we also talked about anything not being preventative, Medicare is going to pay for, Part B is going to pay for 80% of it. That means that as Americans, we're on the hook for the other 20%. And what's critical to know is that 20%, you can see the bottom slide here, that is uncapped. Okay, we would be paying 20% forever. Think if someone was so unfortunate to have cancer and needed chemotherapy, how gigantic 20% of that hospital bill would be. I mean, that could be catastrophic and wipe out someone's retirement savings, which we do not want to happen. So that brings us to the next part of the presentation of, well, what do we do? How do we cover the gaps? How can we prepare for future costs? We're going to talk about this next. This is a really important section. Here's what we're going to talk about. 2 ways you can do it, okay? First one in the blue is getting a Medigap plan, known as a Medicare supplement plan. This is the more expensive option for you. This is where you pay a higher monthly premium, but you get a lot more coverage, okay? So a lot less out of pocket after the fact. Number 2 in the green here is the Medicare Advantage plans, okay? That's your other option. Definitely the cheaper option, but with that, there is the potential for higher cost sharing and more unexpected out-of-pocket expenses. So like everything in life, there's pros and cons to each of these. We're going to tackle all of that. And the important thing that we want you to walk away with today is to be educated. So when you come to this time in your life, you fully understand how it all works, and then you can make the best educated decision for yourself. Because as I go through it, this is so not one size fits all. It is very case by case specific, as you'll see. But let's dive into Medigap plans and how they work. Off the bat, people love these because we're not dealing with doctor networks, okay? You can see here, there's no referrals necessary. There's over 1 million providers throughout the US. Really, any doctor or physician you want to get your coverage from, you can go ahead and see that person. People love these for that. Additionally here, in the middle, they're great for nationwide travel. Maybe people are, retired, they're on, Medicare, they have a Medigap plan, and they want to travel the country in their retirement years, which makes a lot of sense. Your Medigap plan would travel with you because you're not tied to a geographic territory. You're not in a network, okay? And then additionally, they're easy to get, okay? Each plan has a standardized set of coverage. And I'm going to explain what I mean by that on this slide, okay? There's 10 plans, and each one is going to have its own set of coverage. And what you'd want to do is shop plans in the area that you live in, okay? Find the one that's best for you. And then what you'd want to do is go through which insurance provider is going to give it to you at the cheapest rate, okay? So let's say, for an example, I like this Plan G. I think Plan G is best for me. It doesn't matter if I get Plan G from Aetna, Blue Cross, Cigna, United Health, whatever. I want a Plan G, and then I want to find who's going to give it to me at the cheapest rate, right? That's all. That's how these work. But these are great. Hence the name. They are meant to pick up the gap or supplement what original Medicare doesn't cover. So let's go to that broken knee example. Remember my deductible, inpatient, I'm paying $1,700. Well, my Plan G, Part A deductible, they're paying all of that cost. I'm not paying a dime. My Medigap plan is going to pay for all of that, right? See how this works? So you can see here all the different percentages. Of course, the more 100s is going to be more expensive. So that's up for everyone to figure out what's best for their budget. But just know that that's how these Medigap plans work. Okay. And what I want to do on this slide is I want to put it all together for you, because I realize at this point I've been throwing dollar amounts at you saying it's going to cost you this, it's going to cost you that. Let's talk about what this option might cost you on a monthly basis. Okay. So let's say you've worked for 40 quarters of work history. Part A will cost you nothing. In this example, let's take IRMA out of it and say the Part B monthly is $185 a month. We'll take the national average for Part D at just over $55 a month. And then Plan G is quoted at $100 a month for anyone on today's call out of Texas. That's where the folks who create this presentation that I'm delivering today is from. So they quote from their state. It's going to depend on your state. I can tell you here in Massachusetts, that's going to be probably closer to like $250, $300 a month. It's more expensive here in the Northeast, but let's say for $350, $400 a month. Again, this is the more expensive option, but with that would be a very sound medical coverage that you would get if folks can afford this route, okay? Moving on to this slide, I often say I think it's one of the most important slides of the presentation. And the reason for that is because when you enroll in Medicare Part B, the clock begins to tick, okay, on this one-time 6-month window we have to enroll in any Medigap plan that we want without being asked any health questions. So if someone has Parkinson's, if someone has cancer and needs chemotherapy, they're going to absolutely need a Medigap plan to help pay for that. Okay, and as long as they do so within 6 months of enrolling in Part B, they cannot be denied any sort of plan that they want because of underlying health conditions. Now, moving on to the right here, it doesn't mean that if you miss the 6 months, you can never get a Medigap plan again. What it means at that point is now you're going to be going through underwriting. And the insurance company is going to do a 2 to 5 year look back on someone's health history. And if they have underlying health concerns, we know there's a good probability that person might not get the coverage that they want. So really important to know that that 6 month window does exist. Now, what I can tell you is most of the United States, in fact, 36 states follow that more stringent federal guideline. If anyone on today's call lives in any of these 14 states, the good news is that these states take a much more lenient interpretation of that federal guideline. What I can tell you in Massachusetts and New York, where I live, it's open enrollment all year. People can change plans anytime they want, and that might sound great, but the rub on that is these states tend to be very expensive with that premiums. Okay, so there's a kind of give and take on that, and this is what I mean by Medicare being very case specific on everyone's individual situation, the state that they live in. Again, I understand this can be confusing. We're trying to just break it all down, but the point I'm trying to make is create the awareness. Okay, if you live in any of these states, you're going to want to look into what the state allows as it relates to Medigap. Okay. And that brings us to really Medicare misstep number one, and it's folks confusing that one-time 6 month window when it's gone with the annual election period that takes place every fall. And that's when folks can get the Advantage plans without any health questions, any plan that they want every single year in Part D as well. Okay, that's when you can change those plans. The Medigap for most of the United States does not work that way. And then before we move on, what you'd want to do is just ask your provider, do you accept original Medicare? If the answer is yes, they're going to automatically accept Medigap. Okay, we talked about the plans being standardized. So in terms of coverage, what you see is what you get. Let's just shop who's going to give it to us at the cheapest rate. Really important to know is that Medigap plans are guaranteed renewable. So what I mean by that is if you have a plan and you become sick, the insurance company cannot deny you re-upping that plan. They must guarantee that your coverage is renewable, even in the event of sickness. Really important to know that. And then equally going below that, know that the benefits don't change annually, which is a nice thing. So think about Medigap being more of a set it and forget it type approach. The premium might change, good chance the premium might increase on you. But why that's so important to know is because later on, when we talk about the Advantage plans, the benefits could change on those. The Medigap plans, the benefits do not. And then making the comparison again to the Advantage plans, the Advantage plans oftentimes do have a drug component, right? Like a Part D component. The Medigap plans don't work that way. So what you'd want to do is you'd need to add a standalone Part D plan to make sure that you get the medication that you need. As if Medicare isn't confusing enough, Part D has a 3-step process in terms of what it might cost you. This might look daunting, but a couple of years ago, this was a 5-step process. It was way more confusing, way more painful. We can thank the Inflation Reduction Act for just simplifying this. So I want to tell you what I mean by that. On this slide, first you hit your deductible. Okay, this year it is up to $590. That's the ceiling. After you meet that, you kind of live where most Americans live here in the initial coverage phase, where you're doing your co-pays, things like that. Then once you hit $2,000 out of pocket, we are done. We are done on Part D spending for the year. This is one of the biggest changes to Medicare in 2025. It's a huge one for us as Americans to know that we are capped on our Part D drug spending at $2,000. And why that's so important was because last year that was $8,000. In years before that, even when you hit $8,000, you were still paying like 5% out of pocket. Okay, so again, I can't stress enough this is important to know that this exists, and that once we hit $2,000, we're done for the year. At that point, we fall into what's called catastrophic coverage, and you'll see here the insurance company pays 100% of covered medications. Okay, let's quickly talk about what the Inflation Reduction Act did to Part D. So a couple of years ago in 2023, it added a lot of vaccines that weren't covered. Biggest one was shingles. Used to cost folks $600-700 to get a shingles vaccine, and people like, what in the world is that? That's how it used to be. Government recognized that some of these vaccines that fall into Part D need to be covered. then I'll cover that 100%. That's a great win. Anyone who has diabetes, insulin shots, no matter where you are in that, $35 an injection. Okay. Also, they put a cap on how much they can increase the premiums. Insurance companies cannot go north of 6%. That is the cap in a given year. All right. And then they also increased what's considered low income. Used to be 135% of the federal poverty level. They expanded it last year to 150%. Again, this whole thing is to make medication more affordable for folks on Medicare. Now, we just talked about the biggest one of this year, 2025, $2,000 annual cap on Part D spending. And then, so what's going to happen next year in 2026, really to 2031, is the government's going to take about 10 drugs a year, okay, each year, and they're going to just renegotiate pricing with big pharma companies, making it more affordable with a lot of drugs that people on Medicare depend on, like cholesterol, heart disease, arthritis, cancer type drugs, things like that. This is already happening now, right? Some of you might have read this in the Wall Street Journal and whatnot, but just know it's not going to go into effect until really next year. So we're coming up on that time period. Okay. Alrighty, I said there was two options to cover the gap. We are going to close the book on the first one. All right, we're shutting the book on Medigap. We talked about that. Now we're going to talk about a section I get asked on all the time, and it is the Medicare Advantage plan. So the way the Advantage plans work, again, these are Part C plans, this is the option we have of getting all of our coverage through a private insurer, okay? A lot of times the Advantage plans are going to work in a network format. It could work something like a PPO, or it could be an HMO type thing, right? We know we need to stay within the walls of that network, except in certain emergency type situations. Now, why people love these is that they can get them any fall, right? There's no health questions with these. So as you do your research during open enrollment, you find a Medicare plan, Advantage plan that's offered in the area that you live in, you can get any plan that you want. Additionally, they're easy to get. People love that. They're like a bundled package. If you can see this blue box here, a lot of times the Advantage plans are going to add dental, vision, hearing, gym memberships, all bundled into one package, all of that kind of stuff. Okay. Now, the flip side, though, is sometimes you might hear your doctor not loving these, being frustrated with these. The reason for that is you need prior authorization for procedures. The Advantage plan may or may not pay for that. Let's again go back to my broken knee example. And the doctor says, hey, I'd like to take a closer look at that knee. I want you to go get an MRI on that. I can't just go next door and get that MRI. I need to play the game with my Advantage plan insurance company to see if they're going to pay for that. They may and they may not pay for that. So that can be frustrating to a doctor that gave me a diagnosis, and we can't just move forward with that. Okay, so just be aware that that's how they work. Again, these are the cheaper plans. Okay, but just know you have like co-pays and co-services as you go along that I'm going to talk to you about on this slide. So in this slide, this is how an Advantage plan might work. It might work something like $20 to go see your primary care, maybe $50 for a specialist, okay? Ambulance ride, maybe $300, right? Kind of things like that. The most important thing I need everyone to walk away with on this slide when we talk about Advantage plans is this thing here in the middle called OOP. That stands for your out-of-pocket max, okay? And if you can see down here, the max limit this year is just over $9,300. Every year that goes up, we see it go up about $500 to $1,000 a year, okay? And what that has to do is when we go into some of these big ticket items like chemotherapy, someone has kidney failure, needs dialysis, you might get a hospital bill for 20% of that cost, and people don't know that. It's almost like the IRMA thing. They say, what in the world is this, hospital bill, and I'm not paying anything a month. My Advantage plan is so cheap. What in the world's going on? A lot of people don't even know this exists when we talk about the Advantage plans. Because I promise you, George Foreman is not, he's going to tell you how great the plan is. He's not going to tell you about an OOP. Now, keep in mind, this is the max limit. You might find an Advantage plan that has one for, $5,000, $6,000. It's going to vary. Just that's the limit this year. If I had to guess, it's going to be kissing $10,000 next year. Just my guess, okay? And then as we move over to the left here, 7 in 10 plans last year, or in 2023, had a $0 premium. Well, that sounds awesome, right? That sounds like free health insurance. Sign me up, of course. But then as I begin to think about that, I'm not exactly sure it passes the smell test, and they begin to think about, wait, Medicare Advantage plan's bad? What's going on with these things? And I'm certainly not here to say that they're bad. I'm here to say that they're heavily misunderstood. Some Americans love them. Just keep in mind, they are great when you are healthy. When you are paying nothing a month, everyone loves that. If you do become sick, keep in mind, though, that you might be paying up to 20% of some of these very expensive procedures and medication, things like that. It's something to be aware of when we talk about the Advantage plans. So that brings us to the next section where if you'd like to go the Advantage plan route, we do have some tips for you. Number one, simply build a rainy day fund up for any unexpected cost. Hopefully, you will never need to tap into that, but if someone does become sick and that OOP comes into play, a lot of times if someone becomes sick in most states, then they probably wouldn't be able to go over to a Medigap plan. Remember how that works? If they have underlying health conditions, they might be stuck in that Advantage plan. So they might be paying some of that OOP, and they're going to be happy that they allocated some of their retirement savings to help pay for that, okay? Number two, know that how and when you enroll matters, meaning you need to enroll every fall from October 15th to December 7th. So we're coming up on that when you would enroll in an Advantage plan. And then number three, if anyone like to travel nationally, you might want to find more of a large national carrier to not be so handcuffed to a smaller local network of doctors, more of a national network. And then really important is number four here, where you cannot forget to reevaluate your Advantage plan each and every single fall. What's going to happen in September is folks on Advantage plans are going to receive something called an annual notice of change. And what is going to happen in that notice of change is it's going to outline the following year any sort of procedures or medication added to the plan or taken away from the plan. Okay, so if someone depended on a procedure or medication, didn't bother to read that notice of change, and the following year, all of a sudden, an expensive drug that used to be covered isn't, well, unfortunately, that person will be paying out of pocket the entire year until they can get a new Advantage plan that's going to pay for it. Okay, so really important to know that you read that notice of change in September. Then in the fall, you have plenty of time to shop a new Advantage plan that now has the coverage that you need. Okay, so that brings us to Medicare misstep number two, and it's really folks not understanding how amazingly different the Medigap plans work from the Advantage plans. Earlier, we talked about the Medigap plans being more set it and forget it, right? We talked about the benefits not changing annually. When we talk about the Advantage plans, we just talked about that notice of change, that you would need to do some research every year. You will need to do your homework to make sure you're covered. You're going to be happy that you did, because if you're no longer covered with certain procedures, you're going to need to find a new plan. You're going to have plenty of time to do so. Again, just keep in mind every year in the fall, you're going to have to do a little bit of homework to make sure that everything's all in place. Okay. Now, this brings us to our next topic, very important. I get asked this all the time as well, is what does working past age 65 look like? Okay. And I think the easiest way we can talk about this is by drawing a line in the sand, which is what the government does, of do we get our health coverage from a large employer or a small employer? And by that, I mean the government says a large employer would be defined as an employer who has 20 or more employees. They say that's large employer. A small employer is anyone with less than 20 employees. And it's very critical to know where you get your health coverage from. Let's talk about large employers first. Well, the government's going to say the group coverage that you have is primary, okay, and any Medicare you have is secondary, all right? The easiest way to talk about this is if you get your coverage from a large employer, you have the option of delaying enrolling in Medicare at age 65 with no penalties at all, okay? A lot of times people ask me, hey, I turned 65, do I need to enroll in Medicare? Or they'll say, hey, my whole family's on group coverage. I have a spouse who's older than me. Do they need to enroll in Medicare at age 65? What I would say is the nice thing is you have the option to do a cost comparison. It might be more budget friendly to stay on group coverage because we know every company has different types of coverage. So maybe that makes more sense in terms of what you get bang for your buck. Or maybe the flip side's true. It might make sense to have that person or for you to enroll in Medicare. Okay. Just know it's nice to have that option to figure out which is the best for you. Sometimes what we see people doing as well is they'll be at age 65, they like their group coverage, but then you'll see them enroll only in Medicare Part A, okay, because they're paid up. It doesn't cost them anything. So they say, well, why wouldn't I have some secondary, safety net in place in case I have an inpatient hospital stay? And you can certainly do that. Just keep in mind, folks, that when you enroll in Medicare, you can no longer make contributions to your health savings account. If you enroll in Medicare and you continue to make contributions to your HSA, then come tax time, unfortunately, you're going to get a penalty on that, right? The government loves hitting us with penalties when I feel like we're just trying to do the right thing here. But it's important to know how it works. Some people might contribute to an HSA. They want to max it out, and they'll say, no, I'm not going to, enroll in Medicare. I'm going to pump as much as I can into that HSA. Other people will say, hey, I don't care. I don't even do that anyway. I want the safety net on Part A. Again, for everyone, that's different. Okay. Now let's flip everything I just said. Now let's talk about small employers. Okay. The government is now saying that Medicare is primary. And anytime they say Medicare is primary, that means that you would need to enroll at 65, or you would need to have credible coverage to make sure that if you're not enrolled at that age and do so at a later time, there can be potentially penalties for that. Okay. So we're going to talk all about this right now. So small employer, Medicare is primary. You can still keep your group coverage. A lot of small plans have great coverage. You can kind of still keep that as a secondary safety net. But I want to talk to you about that penalty. And I think the way to do that is, let's say we have an electrician. He works for a small shop with 12 employees. He's 65, really likes the coverage, and says, nope, I'm not going on Medicare. I'm keeping my coverage. Okay. Now he's 2 years later, he's 67, and he figures it's time to hang it up. I'm going to retire. I need some Medicare coverage. And the government will go, well, you got your coverage from a small employer. We needed you to enroll at 65. You didn't. So for your Part B, it's a 10% penalty each year that you should have enrolled, and you did not. So this person, this electrician, because it's been 2 years, right? He now has a 20% penalty tacked on top of his Part B premium that will, again, stick with him forever. And why it's so important to know where you get your coverage from, because a lot of times we see friends, family, what have you say, oh, no, you need to enroll in Medicare at 65. You have to do it. Or other people might say, no, you can figure out what's best for you, all that. You can see on this slide, they might both be right. What's important for you to know is where you get your group coverage from. And then before we move on, I do get asked where folks will say, hey, I have COBRA, okay, or VA benefits. What about TRICARE for life? I have that. Do I need to enroll in Part B? What I would say is all of those are not considered credible coverage, okay, when Medicare is primary, right? So you can still have those secondary, right? VA benefits or TRICARE for life is fantastic secondary coverage. So that person might want to enroll in original Medicare, and maybe they don't need an Advantage plan or a Medigap plan to pick up the cost because their TRICARE is doing that. Just know that the TRICARE wouldn't be considered credible coverage. So if that person was of a certain age and then went to enroll in Part B, they might get hit with a penalty because the government's going to say, well, during that time, you didn't have credible coverage. Or if someone was in a situation of thinking that COBRA, as you can see here, is primary, COBRA might be credible for Part D, but for Part B, it probably wouldn't be. And that person would need to enroll in Medicare Part B to avoid that. So just really important to know the coverage that you have and what's considered primary and credible, okay? Now, this is going to bring us to the final portion of the presentation. We're going to do a high-level overview of everything that we just talked about. And we talked about the 4 parts of Medicare, A, B, C, and D, where we know parts A and B is what is considered original Medicare, and the only 2 parts we get from Social Security. We know that Part A is going to be our inpatient hospital coverage, and Part B is going to be outpatient. We talked about Part C being the Medicare Advantage plans, right? That's the group bundle coverage option we have through a private insurer, right? They're the travel agent. They're going to cover the flight, rental car, and hotel stay. Okay, so that's the Advantage plans. And then the Part D will be all of our drug coverage. Okay, this slide we're gonna talk about how do we cover that gap. Remember that 20% gap that exists in original Medicare, and we have the 2 options. The first one is having original Medicare A and B. Then we add a Medigap plan, also known as a supplement plan to supplement that cost. And then we would want to add a Part D plan to that to make sure we have our medications. This is the more expensive option, right? So we're going to have higher premiums. But as a result of that, we're going to have little to no out-of-pocket cost after that. Okay. Typically, if people can afford this route, they want to take this route. It's more expensive, but they like the coverage they get, and they're not dealing with doctor networks. Moving to the bottom is the Advantage plan. This is certainly the more budget, pocketbook friendly version where we're paying lower premiums in most plans. We talked about there being no premium at all. Okay. But then we talked about that OOP existing. There's that more unexpected potential for cost sharing. And with the Advantage plans, we are talking about a limitation on doctors because of doctor networks. And then moving to the top here, I would discourage anyone from only having original Medicare A and B with no supplement because there's no cap on that 20%. We are left completely naked to that 20% cap. So if someone was to become sick, they would be paying 20% forever. Okay, that would not be good for many people's retirement savings. So we'd want to make sure that someone gets a Medigap or an Advantage plan, whatever's best for you, to make sure that you have some of that cost covered. And then we just talked about this, but it's so important. Let's talk about it again. And that's working past age 65, where if we go to the top and the company we get our group coverage from has 20 or more employees, they are considered a large company. Point being, we can delay enrolling in Medicare at age 65, and there's no penalty for doing that. And as we go to the bottom here, we know the other side is true where the company has less than 20 employees. We know that we must enroll Medicare Part A, B, and D to avoid penalties where if we delay that and enroll later in life, those penalties might exist. Okay. So before I pass it over to Gina for some Q&A, I do want to touch on a couple of resources available to you if you'd like to talk more about Medicare. First one here, folks, is ssa.gov. If you can see that, that is where you would enroll in Medicare. Remember IRMA, that ugly IRMA we talked about? That is where you'll find that appeal form, SSA-44, for your Part B premium. You would pay it all right here. And then I do like to give a shout out to a firm out of Texas, Boomer Benefits. They are Medicare insurance agents. They are not affiliated with Gina or I at all, but they're a trusted resource. They create this presentation that we talked about today. Anytime I go on Google to learn more about Medicare, as many of you I'm sure have experienced, there's so many pop-up ads with Medicare Advantage, like everyone's trying to sell us stuff when all we're trying to do is find facts. They have a lot of great blogs, things like that. So you might want to just jump on their site if you'd like to learn more about this. So Gina, folks, thanks everyone so much for your time. I can't see if anyone's sleeping, so I don't know if we tackled number 2, but I hope we tackled number 1 where everyone walked away with an enhanced understanding. And as time allows, I'm happy to entertain any questions that we might have.
Okay, awesome. Thank you so much, Ron. I know, again, I just want to reiterate, we covered a lot of information today. It is recorded, so you can go back, you can rewatch it. I can send you the deck, and I can send you that fantastic Q&A compliments of John Hancock. It's a great Q&A guide. So we've got a lot of resources for you. I'm going to get to the questions. I think Ron did a good job, I think, answering a lot of the questions in the Q&A and chat, but if you just hold on tight, we will get to some of those questions as well. For those of you who need to drop off, I just want to remind you, we do have some great webinars. These are all of our webinars for 2025. Again, keep in mind they are housed on our website and YouTube channel, so you can get them on demand. If you ever have any issues, just reach out to our team. We'll email recorded presentations to you, but thank you for that. Again, if you have any questions too about Medicare or anything else, I might not know the answer, but I can certainly enlist Ron to help us answer those questions. So again, I'm going to get to some of the questions for those of you who have time to hang on. For those of you who need to go, again, thank you so much. Appreciate your time to get a little better educated on this really, really complex topic. Okay, so Ron, just a couple things. I'm just looking at I'm going to start with the Q&A and then we'll get to the chat too, but just a couple things might be worth reiterating. First of all, if your spouse, if you're covered under your spouse's insurance, at age 65? Do they need to enroll in Medicare? That might be a good one just to reiterate. And again, I think it goes back to the large employer, small employer, but maybe you could just touch on that one more time.
That's right. I totally agree with what you said, Gina. Happy to cover it again because it is so important. I get asked this so often. Step one is what you said. We would need to make that determination of does the group coverage come from large or small? That's going to dictate options. If it's small, we know that we need to enroll at 65 to avoid any sort of penalties that might incur. If it's large, we have the option, which is great. And what we're going to want to do is a cost comparison of what do we get for coverage through the group plan versus what's Medicare going to cost me if I go the AB Medigap route or if I go the Advantage plan route. Very important decision, but it's always nice to have options. So I would say first off, we need to know large or small employer, large cost comparison time.
Yep. Okay. Awesome. Thank you for that. Also very important too, and we run into this a lot with HSA accounts. I know you mentioned it, might want to reiterate that, but the implication of continuing to contribute to an HSA once you've enrolled in Medicare.
Yep. Another phenomenal question. So thanks everyone for asking these. So when you enroll in Medicare at age 65, you can no longer make HSA contributions. Two things to be aware of. First one, you are not eligible to receive Medicare until you're 65. So if you enroll, you remember that IEP? If you enroll in Medicare and it begins the first day of your 65th birthday month, I'd say a best practice is a month or two before your 65th birthday month, just stop making those HSA contributions, okay? Because nothing's backdated. Now, the other side to really be aware of is say someone, and let me give you an example. Say someone's 67, they're on group, benefits with a large employer, and all of a sudden they decide Medicare is more cost effective for them. When they enroll in Medicare past age 65, again, this example, they're 67, Medicare does a 6-month look back. So that means you would actually be covered 6 months prior to enrolling. So what that means is any HSA contributions you made during those 6 months would make you vulnerable to the penalty. So again, you enroll at 65, you're fine because, it wouldn't be 64 and a half, you get it, it'd be 65. But if we delay that, just know that 6 months grace, previous grace does exist, and we want to stop contributing 6 months prior to enrolling past age 65.
Great.
Okay.
Really important to remember that implication. We run into that one a lot. Thank you for that. Another quick question. Again, Medicare excludes dental, vision, and any other benefits?
I think that question, so it might not, I mean, original Medicare doesn't cover that. Okay. We'd want a plan. So the Advantage plans, and I should have mentioned this before, folks, there's 10 Medigap plans. I'm in Massachusetts. We only have 3. And a lot of times I ask people to raise their hand and just say, guess how many Advantage plans exist? And the person closest to 4,000 would be right. And the reason for that is because insurance companies make so much money on these. So many of the commercials, the stuff in the mail, all that stuff's the Advantage plans. But I'm not here to say that they're bad. It's just they add a lot of white noise to this discussion. But point being, a lot of the Advantage plans are bundled. So they might have dental, they might have vision, things like that. But a lot of times if you enroll in a Medigap plan, this services you can kind of tack on to that monthly to get those. So it's not like, you're completely blind. It's like, hey, I'm on a Medigap plan. What do I do for these? You can just kind of it's just more like a la carte, for it. It's not as group bundled as an Advantage plan would be.
Right. Yep. So just do your research, do your homework when you purchase the Medigap, or at least understand the benefits covered under the Advantage plans as well.
Right.
So that is great. A couple others. Okay, we just talked about HSA. Oh, I know somebody asked, could you maybe just elaborate one more time on that look back year, the 2-year look back for determining your income and ultimately how much you would pay?
Yes.
And feel free, if you want to go back to that slide too,
I'm
Ron.
gonna go back to that slide.
That's a pretty helpful one.
Am I going the wrong way? Oh yeah.
I think
Give me a
so.
second. I know this slide's like 400 pages. Let me.
Right. Got a lot of
It's
slides.
just so Irma. It's so important to understand Irma. Let's talk about this. So okay.
And Yeah,
Go ahead.
and to your point, Ron, you gave a great example because I've had people take a huge 401k distribution, maybe to pay off a house, buy a second home,
Hmm.
and I always remind them, hey, if you're going to collect, if you're going to apply for Medicare, keep in mind that just inflated your
Hmm.
income for that year, and you're going to pay more for Medicare. So I appreciate you using those examples. But yeah, maybe just cover this one just one more time briefly.
Yes, and I forgot to mention something, folks. So glad we're going back to this. The penalties we talked about. Remember how I said those stick with you forever? I guess the good. I don't know if there's any good news with IRMA, but if someone does get hit with an IRMA, that doesn't stick with you forever. Okay,
Mhm.
it's always that 2 year look back, right? So the IRS is going to determine, in 2026, they're going to look at 24, 27, 2020, et cetera, et cetera. So potentially, Gina, if someone takes that large 401k distribution to pay off the house and they get whacked with the IRMA, unless they do that the following year, it's, they're going to pay it for that 1 year, unfortunately, but the next year it's going to roll off. Okay. They're not going to pay that the rest of their life. So just be cognizant of when you might enroll, at what age in Medicare, and know that the government's going to look at your tax return 2 years prior to that to determine what they call an IRMA. Okay. So like I said, some of those life events that, yeah, we want to buy a, second home, all that stuff is fantastic. Just be cognizant that you might want to take that prior to 2 years before. Like Gina said, that she's seen this real life of people getting hit with these real money out of pocket, just because they weren't aware of that 2 year look back and how IRMA works.
Yeah, great. Thank you. Yeah, that's a good one to keep. Again, it's great to have this deck, and it's great to have the recording because this is something we don't expect you to remember. And obviously these amounts, they change every year. That's why we do this presentation every year. But again, this is some of these slides are really nice to go back and look at and refer to, just to give you a little bit of perspective. So keep that in mind. Just kind of scrolling through the questions. Somebody did ask, if you retire overseas, do you still have to pay Medicare? That's a good question.
If you retire overseas, well, it depends on where the primary is, because if the primary would need to be in the continental US, but if someone traveled, that's another good, see, great questions, folks. If someone, Medicare is meant to cover the walls of the United States, okay? But Medigap will cover a lot outside of that. Advantage plans probably won't. Medigap will go outside of the US, usually up to 80% of the cost. So if someone wants to travel globally, for coverage, they might want to look into a Medigap plan, because that would not only travel with you in the US, but also it would cover a portion of any sort of foreign coverage that you would get.
Yeah, great. And one more thing too, just because we've got a lot of questions on the Medigap plans and the Part F, Part Gs. Would you mind landing back on that one
Yep.
slide, Ron?
Okay.
Just so people can, if you're still hanging on, maybe you want to snap a picture of that one. That chart is really helpful. I know somebody asked, like, where do I start if I need to get a Medigap plan, or if I want a Medigap plan? I know you gave us some resources, but any pointers on how to get started, who to work with, to sign up for a Medigap plan?
Yeah, you'd want to, you'd want to look at which coverage is best for you, but also I think you'd want to start with what is offered in your state, because again, these are through a private insurer. It's gonna depend on, for pricing, where someone lives,
Yep.
age, tobacco, all those determinations. So you're going to want to start with where you live. If you can see down here in the bottom, Massachusetts, like I said, most of the US has 10 to choose from. We only have 3. So if I get, actually in an hour, I'm giving this presentation to folks out of Massachusetts, and I'll have to make sure to bring that up specific to them, because they don't have all these options. Okay. Folks in Minnesota, Wisconsin, some of you might not have all these options, same as me. So we want to start with what's offered in the state for Medigap, find the coverage model that we like, okay, and then go to the insurance companies and say, United Health, I'm making this up, like I want L. How much you're gonna, like, see how much it's gonna be, but what we do know is coverage is standardized. So it's not like Cigna's gonna give me L with X, Y, and Z, and then Blue Cross is going to give me L with A, B, and C. It doesn't, this standardized coverage, but it does depend on what state you live in to see what's offered in that state. Then you'd want to see which insurance provider is going to offer it in the state. So kind of two levels of research with the Medigaps.
Yep. Very good. Very good. And is there some Medigap information specific to states available on the Medicare website?
Yeah, I want to say, do we have that on the resources like Medicare.gov to see again, credible website. We
Yeah,
like
the
credible
resources is
websites because
another, yeah, that resource slide. If you have your phone, I like
yep,
to snap pictures. This might be one that you might want to snap a picture of, because yeah, there's some good
yep.
resources right there.
Medicare.gov, like I said, yep. So that's the one. A lot of great, it's just basic stuff to read on. A lot
Hmm.
of the questions you have, millions and millions and millions of Americans. I do this all the time because it's so heavily confused. They could not have made this more confusing on us. So really, like Gina said, there's resources here, credible ones, that's going to have factual information for you to research more about this. Medicare.gov would be a good one to see. I think they have state specifics on there.
Okay. Okay, perfect, perfect. Yeah, just to give people a starting point to do some research in their states. And again, I know like the boomer benefits, Lauren Bigham, there are people like that, across the country. But again, as Ron said, that's somebody who's a trusted resource and maybe able to assist as well. So.
Yeah, and just like for my auto insurance, personally, I have an agent. Not everyone does, and they just shop insurance providers to find the coverage I need. Medicare brokers work like that as well. They might shop Medigap plans, Advantage plans in your area. A lot of time it doesn't have to be Boomer. There's many of them. A lot of times they're free, so that's another option as well because this is daunting and confusing. So maybe you'd want to research a trusted agent in your area to help you with that decision-making process.
Yeah, exactly. Again, not free, but to help you avoid making mistakes, it might be worth engaging in an agent like that. So they can certainly be much more specific. I'm just checking any other questions here. What about, well, flex savings accounts? Now those are a little bit different than health savings because health savings accounts you can hang on, use them 10, 20, 30 years down the road. Health savings accounts, do they have similar rules to the HSA?
Go, man. Someone got me. I'm a little rusty on that. I've researched this before. So HSA is the one. That's the
Yeah,
big one with
HSA
the
is really the
penalty.
one you want to be
I
careful.
want to say it's not like I think there's parameters around flex what you can like HSA. You can't use that for Medigap monthly
Mhm.
premium. It's like the only limitation on that. Flex, I'd have to dig into it, but the tax penalty is specific to HSAs,
Okay,
not
yeah,
flex.
that's what
Okay.
I thought. Okay. Don't see as many FS flex savings accounts anymore with the advent of health savings.
I've got asked that, but that like again, companies are different. For Medicare is so case by case, it really is. But it's important to, like I said, thank everyone for coming today. Be educated, and just hopefully know more about how it all kind of conceptually how it all works.
Yes. And Ron, I know you've got to hop off here. I know you've got another presentation. Like I said, Ron does these all the time across the country to many, many different audiences. So we've got to cut him off here. But again, hopefully you have some resources. Again, you'll have this deck. We've got a Q&A we can share with you. Reach out to me or our team if you have any specific questions. Again, if I don't know the answer, I will get an answer from Ron. So hopefully, if nothing else, we've given you some basic information and given you the resources that you need to at least get started on Medicare. Ron, thanks again for joining us. We really appreciate it. And I'm sure we'll have you back again next year because it changes all the time.
Yep. I look forward to it. Thanks everyone so much for your time, Gina and the team. Thanks so much. And then feel free to reach out with any questions. We can certainly answer those and look forward to partnering next year as well.
All right.